Welcome from James and Radhika at Yoga Plus Therapies, session on learning to love your knees. This is a yoga therapy class to help with your knee strength and knee health. Let's begin by first laying down on your back. Feel the back shoulder blades broad. The back pelvis is broad and even. The weight even between the heels and the toes and between each side. Feel balance in the knees. So you have that awareness of alignment. Take your awareness to the navel. Breathe in, navel rises. Breathe out, feel the navel sinking in towards the backbone. Active breathing. Repeat that a few times. Inhale, navel rises. Exhale, navel flattens. Feel those deeper core muscles engaging without effort or strain. Again. That's number 3. And 4. And 5. Good. Keep mindful that the pelvis stays steady as we go through today's practice. Bring your right knee up over the chest, hole behind the thigh. Warming up through the knee joint. Just begin to lift the foot up to the ceiling to straighten the knee. And then return the knee bent. Choose your breathing, maybe breathing out as you straighten, breathing in, or just the other way according to what feels best for you today. Just get the feeling of movement and breath, and that lubricating effect into the knee joint. If you're more tight with your hamstrings, you may hold your thigh further away with a belt behind the leg. We'll do about 5, but you can do more yourself, up to 10 times if required. That nice warming sensation of movement through the knee joint. Feel the back pelvis is steady though. Not lifting away from the ground. Once you've finished 5, return back down, take a breath. Prepare for bridge. Place the arms to the sides, palms facing up. Draw the shoulder blades back wide, neck relaxed. Align the heels to the buttocks, with the knees over the ankles if you can. We want to focus on the glute muscles as you do the bridging practice. So gently as you inhale, begin to lift the bottom, press the heels and feel the back buttock muscles engaging. Exhaling to lower down. Repeat that 4 more times. The muscles engaging doesn't mean you're tensing them, but it means that you're aware that those muscles are working the right way. You should feel no pressure or strain through the spine. And be mindful that you're keeping your knees stable over the ankles, not rolling inward or outward. If you find they roll a little, you may need to place a block or a pillow between the knees to keep them steady initially. Now, once you've finished, take another breath. And then we're going to come to one side and up to sit. Sitting with the legs out in staff posture. We're now going to just check that the work of your thigh muscles, the quads muscles, and the hamstring muscles are working in an even, symmetrical way. Starting with the right side, place your hands on the outside thigh and the inside thigh, just with the inside thigh, it's just about 2 fingers above the kneecap. And you're just going to gently tighten the thigh muscle and check that it's working evenly on both sides, that the inside especially is working, is engaging, and it's drawing the kneecap up evenly. The kneecap is not tending to swing outward. If it's tending to swing a little bit, emphasize contracting that inner thigh muscle a little bit more. Check the left side as well. When you do this action, careful not to squeeze your knee too far back so you overextend it. But just becoming aware that the muscle action is working evenly. Now, bring the knees a little bent. Become aware of the muscles on the back of the thigh now, the hamstrings. So remember there is two, there's more than two, there's the inner hamstring and the outer hamstring muscles. So there's 2 sides to the hamstring muscles. So we're going to just lightly draw your heel into the floor towards you and see if you can feel the muscles tighten in those hamstrings. And as you do that action, see if the tightening is also even. Sometimes there can be a tendency for one or the other to dominate, especially the inside one can tend to dominate a little bit. You may find as you pull the heel to the floor, you can just slightly change the weight, where it's more inward or outward, until you can feel that the contraction is even, that both hamstrings are working evenly together. Do the same with the other side and make sure, trying to get an equal contraction between the inner and the outer hamstrings. So creating balance in the way your muscles are working. Good. Now, we're going to do a little hip warm-up. Radical just turn 3/4 on for this, just to help see this one. So, remember knee, just help protect the knees. We want to avoid too much rotation in the knee joints. So one way we can do this is use the foot lock action. So you can do that by slightly flexing the toes and foot up. Now if Radhika brings her right knee bent up, just places the outside edge on the inside of the floor, and she's going to lightly press that outside edge into the floor. So that's going to create stability up through the knee joint, and then she can just lightly draw the knee up and down. And what should be experienced here is the movement should be purely in the hip joint. So that's a way of really getting nice movement in that hip joint without creating too much stress through the knee joint or even the ankle. Try it both sides. This becomes more important if you do notice that when you have the knee bent in, it creates a little bit of pain for you. So you can try this action and see if it helps. Remember, in all these practices, they're general ideas, but it may not be specific for you. So if you do have a knee issue, remember you should always be consulting your health practitioner for your specific guidance and advice. Now, finally here we're going to be doing knee massage. Knee massage can be really, really nice if there's discomfort or tightness around the knee. Radhika is going to begin by massaging the outsides of the knee. In the yoga Ayurvedic tradition, massage is a very important part of health of the body. And traditionally, organic black sesame oil was used. It's one of the major oils in massaging. Now, behind the knee you can also massage. At the back of the knee, if you have knee issues, you can sometimes get a pool of fluid coming out the back there, and this is called Baker's cyst. It's a common condition if there is something going wrong with inside the knee. So massaging behind the knee can help to loosen it up and make it feel more flexible. Finally, at the front of the knee, we can do some pain relieving practices. There's 4 points around the kneecap, the patella, that you can use. So on the lower end, between the big tendon, there's little hollows, sometimes called the knee eyes. You can massage circle massages in that area. Use your fingers or thumbs, what feels best for you, and you don't need to press hard. Don't need to be aggressive. Also above the kneecap, you can do massage, the little points circling above it on either side. Same way. It's recommended you do at least 21 circle massages in each area. Let's do the other side as well. But just note, how does that side feel first? Does it feel different? More relaxed? So try the second side. Massage encourages blood flow, soothing. Could be at the back of the knee. And the knee eye points. And below the knee on either side of the tendon in the hollows. And then above the kneecap on either side. Sometimes again little tender points. Very relieving to give it massage. Remember, if you can give it a little bit more time, up to 21 is suggested. You'll find a lot of benefit. So just note how your knees feel now. And when you're ready, we're going to make a transition up to stand. Now, we're just going to do a gentle, simple warm-up to awaken the buttock muscles. It's best you do this holding onto a wall. Be stable and upright. Feel the core muscles active so that your back is not going to move. You're going to place the weight onto the left side, knee off lock. Lift up that hip on that side, and then you're just going to gently extend that right foot back. And do it in a way that you're focusing on the buttock muscles. Feel the back right buttock muscles working. Do it in a way that you feel those muscles working and the back not working too much. It's not necessarily a big movement. So you do it a few times to awaken those muscles, so you're just really aware of them. Try it on the second side. Weight to right, knee off lock, steady. Little hitch up at the hip as you move the foot backwards, engaging the left buttock muscles, what's called the glute max muscles. Keep the pelvis and spine nice and steady. Good. Now we're going to do a foot massage. This helps to awaken the foot muscles, arches, which is also an important part of knee health. And this massage also has an effect of relaxing the connective tissue structures up the lower limb, so it can make it feel quite good. With this, you're going to place the ball under the arch of the foot and massage side to side. The arch towards the heel, towards the middle of the arch, and towards the ball foot part of the arch. It's recommended to do at least a minute on each foot. Press only as far as it feels comfortable, like a really nice massaging effect. You may be aware there are tender points in the arch. And when you've concluded the massage, just notice how it feels through your stance, through your contact of feet and your legs. Do they feel more engaged? And if you walk around a bit, you may just feel a little bit more lively with that walking, especially if you do that for a longer time. Now, we're going to move into some of the standing yoga practices with knee awareness. So let's begin radical stand side on in mountain posture. So feet are a little apart, about hip width. In mountain, the most important thing to be mindful of is that the weight is even and the knees are off lock. We don't want the knees jammed back. That can really put strain on the back knee ligaments. So it's important that you keep your knees in that slightly bent, ready position. They're not real bent, but they're just in that ready to go, so flexible moving position. The weights is such that your pelvises are in line with your heels, your shoulders in line with your pelvises, and your ears in line with the shoulders. So we've got that good alignment. And be aware of the arches and the feet balance. So the weight even between heel feet, ball feet. And at the inside edges of the arches haven't collapsed too much. Or there's too much weight to the outside of the feet. So you want to feel even weight inside, outside. It's that steady awareness and alignment. And be mindful of how are your kneecaps lying. Are they tending to align facing forward? Or is there any tendency for them to turn inward or outward? You may need to do a little adjustments at the hips. One thing that you could do is just slightly pull the hips or the feet apart without actually moving them, and you'll feel the muscles on the hips engage, the glute muscles. And you may feel that just helps to align those kneecaps more in line with the feet. So alignment is a very important part of good knee health. Now, we're going to go into an important practice called the chair posture. It's a very good one for strengthening the knees, and we're going to do it in a way to create balance. Sometimes we can be a little bit thigh dominant in comparison to the glute muscles. So when we do this chair posture, we want to do it in a way that's a bit more glute focused. So to do that, we're going to keep the weight more towards the heels, and the tail goes back more, like you would do if you're going to sit in a chair. Do it in a way that you don't overarch your lower back. That means that you're going to be looking down forward to the floor. You're not looking frontwards. If you're not sure, put your hands on the glutes and check, can you feel those muscles working as you do that chair action? And we're making sure that the knees don't come forward to the toes. The more they stay upright, the better. The more we're getting that glute action. The final thing is alignment. So if Radhika just turns forward for a moment just to show the alignment element of it. When you're bending, you want to make sure you keep those knees in good alignment so that the kneecaps stay aligned with the second, third toe, that they're not rolling inward or outward. Especially be mindful of that inward rolling. If Radhika just demonstrates here, that's a common fault that can occur if you do have weakness in those hip muscles. So we want to avoid that. That can create a lot of increased stress through the knees. Okay, so you can do chair posture up to 10 times. And if you do have weakness issues, then practicing it regularly can help to develop more strength. Now, if you have more strength and control, you can also do the chair posture as a single version where you're putting all the weight on one leg. So Radhika's got more load on her left side, but she's doing exactly the same practice. And she's aware of all the same things, keeping the weight to the heel, the knee back more towards the ankle, the tail going back like sitting in a chair. And you do that up and down in a dynamic way. And keeping a good alignment. When you do the single version, you may find that you pick up your weakness and you might start to roll in more. So be really mindful of that. It may be you've got to do the double legs for a while before you get strong enough to do the single side. So single chair you can do starting with about 3 to 5 and then gradually building up to 10 as well. Keep good core and pelvic control as well. And be mindful of your arches. So not rolling outward or rolling inward. Now, the next posture we're going to look at is the triangle. The triangle posture is a nice stretch with the hamstring, but it's also one to develop good control. We take the feet wider than the hips, right foot turned out 90 degree, back heel adjusted out a little so the toes slightly inward. And we want to make sure your knees are in that off-lock place. So the knees are not going to lock. They're dynamic. And to help keep really good control on that right knee, what Radhika is going to do is just slightly draw a heel to the floor and back towards her so she feels the muscles engaging on the hamstrings as well as the thigh muscles so that they're both working to keep good stability around that knee as she side bends over into triangle posture. The triangle posture, remember, is a hip movement as well. So as you side bend, the left pelvis goes up, the right pelvis in and down. Very good. Let's try the left side. So knees off lock. Engage the hamstring by drawing the heel down and back towards you slightly. So both muscle, front and back, are engaging evenly. And then doing that little pelvic side bend. So the movement comes into the hips. And then you can take it into the hold, into the triangle practice. So we're leg focused today because we're concerned about the knees. Be mindful of your arches as well. You can see Radhika's arches gently engaged on both sides. And that pelvis, remember, according to hip flexibility, it may not be right back. It might be just slightly forward on the right because that will accommodate your flexibility. What we want is the body to be more sideways, not coming forward too much. Good, let's come up. Now, come back to the first side. We're going to bring the right knee bent into warrior 2 posture. So the first thing here is check that right knee is over the ankle. If it's too far bent, so if Radhika goes too far, that puts a lot of stress on the knee. If it's not bent enough, it's weak. So we just find that right place. So engaged right over that position. So it's in that stable position. And the arches are lifted. So the inner knee muscles are engaging. And the pelvis is a level. Even if the left pelvis is a little forward of the right, that doesn't matter, but keep them sort of level. So you want to be mindful that you can be in a position that your knees are in the right place. The back arches are engaging and the knees are always on the back leg, not locked. Now, Radical demonstrate that same posture to the front so we can show you how to be aligned forward. So she's going to step forward towards the camera now. And this is another important thing to be mindful of with the Warrior Two posture. So a very common problem is for the knee to roll in, creating that valgus stress. So we want to make sure the kneecap is heading towards the middle part of the foot. One little trick to help that is if you lift the heel, turn the heel slightly in and the knee out, and then lower the heel, you'll find that you get that really good positioning. See how that good alignment, and this will really help to protect your knee and create good stability. So let's go to the left side now, remembering all those components. So knee over ankle, pelvis is level. Check your knee now is not rolled in. If you need, do that little adjustment, lift heel, roll in slightly, knee out, place it, engage the arch until you feel the inner knee muscles working, and the body gently upright and open. Radhika is showing it in the completed traditional way. But if you need to focus on the lower limbs, then don't worry about the arms at this stage. Back knee is long, but again not locked back. And arch lifted. Let's come forward now. Now take a deep breath in and out. Center yourself and just note how you feel through the lower limbs. Hopefully more awake, aware and strong. Now we're going to do a variation of Warrior One posture now, making use of the wall. This is especially helpful if you do have knee problems or knee pain, and the Warrior Two might have been a little bit strong for you. So we're just going to move the mats to the wall to demonstrate this next one. So step to a wall where your front foot, make it your right foot, it's just a little away from the wall, in a place where you can comfortably hold the wall. You're not feeling like you're leaning over. Now we're going to step the left foot back, hip width, so that foot just very slightly turned out on the left foot, and the right knee is bent over the ankle, exactly as we did for Warrior Two. Take a thoracic core action by broadening the upper back, feeling the upper back spreading back as you press the palms to the floor. That engages your core. As you hold that position and feel the front knee active, arches lifting, lightly press your back heel to the ground and you'll feel the back glute muscles also engaging. This is a nice way to really feel those lower limbs working and engaging. Variation of the Warrior One with the wall. You can do this static like demonstrated, or you may even do a little bend and straighten if you find static is too much for you. It's about finding what works best for you. Now, let's swap sides. Make sure when you step back that you still have the back leg hip width. Don't step behind the other heel. So heel lowered, foot slightly out, knees in that off-lock position, pelvis is forward to the short edge of the mat, facing the wall, left knee bent forward over the ankle, not beyond, so you're in that strong place. Activate that upper back thoracic core, pressing the hands to the wall like a plank. Tummy's active. And feel the back hip engaged, the back glute on the right side engaged. As you lightly press that heel into the floor. Carefully not to jam your right knee backward. Just feeling that even work. And if you want to do that little bit of dynamic as well, helps to get the feeling of how to control going in and out of the movement. Sensation is a really important part of how we move well. If sensation is disturbed, then it can affect how things work. Okay, so we're going to move back away from the wall now to finish off with the balances. We're now going to go through a series of balances. Balancing is a very important function of the knee because it makes everything work in the right way to keep control of good posture when you're upright. So these are all part of improving that sensory element to your knee health. The first balance is called the tightrope balance, where you stand with one foot in front of the other foot and the knees are a little bit bent. Be close to the wall if you have not very good balance, so that you can always save yourself. For some, this is already quite a challenge. If you find that you're feeling steady, you could challenge it more by closing the eyes. You notice you have little reactions through your lower limbs to keep stable. So these reactions are helpful in training your knees to work better and protect them when you're walking in everyday life, especially on uneven ground. Let's try the second side. Remember, make sure you keep those knees a little bit bent. A bit like you're riding a surfboard, that you've got that resilience, you can move, don't be stiff. Let the knees bend a little bit more. And according to whether you feel stable or not, you could have eyes closed for the more challenge. Good. Now, the next balance, and if you do have a little bit of discomfort, be mindful that these balances do put a lot more pressure through the knees. So just do them according to how it feels for you. Leave out anything that creates too much pain or stress. So this one, we're going to stand on one leg with the knee to the front. The stance knee is off lock, remember. It's a little bit bent, resilient. And we want to have the glutes a little engaged too, so make sure that the weight is towards the heel, not too much on the forefoot toes. Core is engaging. Close to the wall again if you need for support. Try the second leg. Knees off lock, resilient. Little weight to the heel. Lifting that other knee forward. Balances can be done anywhere between 10 and 30 seconds according to your own resilience and endurance. Okay, let's try the second balance. This is the tree balance. It's the same thing, we want to have the knees off lock. This time we're going to turn one knee outward without the pelvis moving. So it's just a hip opening. Use that footlock action to help get it so that you're turning outward with the hip, not creating any rotary stress on the knee. You can have the foot below the knee or above the knee according to your own flexibility. This creates a lot more work to the outer hip as well and the outer knee. So it's a different balance to when the knee comes forward. When it goes out like this, it's because it can be a lot harder on your knee. So be careful with this one if you do have knee issues. Let's swap sides. Knees off lock, glutes engaging, core steady. Just turning out with the knee, not the pelvis. Foot lock, so that we're not getting that rotary stress through the knee as we practiced earlier. You'll probably find that you'll be doing the version with the foot below the knee and not above the knee if you do have knee issues. Just the flexibility may not be there to go deeper. Good. Let's try the third balance now, which is where the weight is going to go back behind you. So this is a variation of the Warrior 3. Knees a little bent, weight to heel, take the other foot back, lean the body forward. Now with this practice, often the weight can come way too far forward towards the toes, and you can get a lot of strain on the knee, the front knee, kneecap area. So you've got to really work with this one to keep that weight a little bit back towards the heels and to really engage the glute muscles, especially that standing glute muscle. And in that way, it's going to be much better feeling on your knee joints. Let's try the second side. Nice stable alignment between the torso and the limb, the lower limb. Get that glute muscle engaging on the weight-bearing leg. Check not too much weight forward so that there's not stress on the front knee or kneecap. Good. Take a nice deep breath. Settle and release all the tension and note how you feel. It's that moment of centering. And we're just going to finish with a simple stretch for the thigh, the dancer stretch. So hold the ankle, draw the knee back in line with the other knee, and then if you can, draw your knee towards, or your heel towards your buttock. You can slightly tuck tail under to get a little extra stretch through the front thigh if needed. Use the wall for support if needed. And if you find this difficult where you actually can't hold the ankle, you could always use a belt holding it around the ankle to create the support, the stretch. Okay, let's try the second side. So turning around, if you're using the wall, stance knee off lock, weight to heel. So when you have the bent knee, remember, knees aligned, heel towards buttock without any rotary twist in the knee joint. Best to hold the ankle rather than the foot if you can. Handing on the wall if required. Tuck the tail slightly if you need. We just want to feel the feeling of openness through the front thigh quad muscles area. There should be no knee joint stress. Very good. Take another centering breath before we come down to the ground to finish the last stretches. After your centering breath, we're now going to come down for the final relaxing stretches and relaxation. Now for demonstration purposes, Radhika's just going to turn the mat at a 3/4 angle before she comes down. For this stretch, you may need a good belt. So we're going to come and lay down on your back. With the knees bent up. Now, just before you put the belt around the foot, we're going to be doing a twist to the left side. So we want to have the pelvis in alignment. So I'm going to get ready to just shift the pelvis a little bit over to the right. Once the pelvis is positioned, then we'll bring the belt around the sole of your foot. You're going to hold the belt with the left hand, the opposite hand to foot. The other leg out straight if you can. And we're going to do a little twist. So it's basically going to twist that leg over to the side. The arm can be supported outward. It may be out higher or lower, or even on the back hip area if needed. If it's too strong for you, then just don't use the belt in this variation and have your top leg bent. But when we do it with this straight option, it gives a really nice stretch to the outer structures of the leg thigh area. Just want to breathe and release into the stretch. Of course, like all other practices, if this creates any discomfort for you, then leave it out. Very good. Let's come back up. Release the belt. Recenter the pelvises and then prepare for the second side by shifting the pelvises to the left. Belt around the right or the left foot, holding with the right hand. And we'll do the rotation twist over to the right side. If it's too much stretch to have the foot on the floor, you could also have a block or some cushions or something to support the leg on to the side. You want to be in a place that you feel you can just relax and release. Very good. Slowly release yourself back. Recenter the pelvises. Bring the knees gently in for one last little back release. If it's strong for the knees, you can always hold behind the thighs rather than the legs. Again, do what feels right for you. You may have the knees apart rather than close together for more comfort as well. Then when you're ready, we're going to release out for final relaxation practice. Be warm. So we can prepare for the relaxation. You may need support under the head or the knees. A pillow under the knees can be quite nice if it's a bit hard to have the knees dead straight. A little bit apart, relaxed feet, toes. The back pelvis is resting back evenly. The back shoulder blades resting back evenly. And the head laying evenly. Arms a little to the sides, palms up if comfortable. Cover yourself if you're cool. Let the breath become natural and even. Feeling the belly rising and falling. Letting all the tension drift away. And you can choose just to rest here and do nothing else but just rest. Or if you like to do visualization, we can just try a simple healing visualization. With the awareness at the navel, imagine a coloured energy ball light at the navel, in a colour that's healing and soothing for you. See and feel that energy ball light around the navel, expanding with each inhale and letting go of all the remaining tensions with each exhale. We're going to send that energy through the body. Feel it going up towards the head, out to the fingers and palms, all along the spine, down to the hips, the thighs, right down to the toes, and especially feel that energy healing light around any part of the body you feel it needs extra attention. It may be the knees, the front, the back, the inside. It may be around the feet and ankles. It may be the hips. But just see that healing energy there, pulsing away, soothing and restoring health to that part of your body. Feel the vital prana returning. And as we conclude the relaxation, just reflect yourself. What can I do this week to give more health to my needs? What changes can I make to my everyday life? And are there things going on in my life, my stresses, my emotions and feelings that could also be influencing what's happening at the knees? We'll come back now by taking 3 long, slow, deep breaths. Bring those legs slowly bent up. And a little rock of the knees side to side if required. Take your time whenever you're ready to come up. And just finishing with the legs. They may be out to the front or crossed according to how it feels for you. Thanking you, James and Radhika at Yoga Plus Therapies. Namaste.